Overall, the most common sports-related fracture would be an ankle fracture. So it's really a joint that's most at risk when you're running, jumping, cutting, twisting, turning. An acute fracture would be an acute trauma. So the basketball player who was in the game, past week, he was running, jumping, cutting, twisting, turning, and ran, and all of a sudden his leg broke. It's not a typical kind of fracture you would get in a sporting event. So it's highly likely that he probably had some predisposing issue going on with that leg. The more common thing you would see with that type of mechanism is if you landed funny on his ankle, you either sprain his ankle or possibly fracture his ankle, depending on the amount of forces that are going through the joint.
Stress fracture is a little different. So stress fractures typically occur in endurance athletes. It's a process that occurs that your bones remodel to fit the needs of your activity, and that remodeling occurs immediately after you're done exercising. If you exercise or run at a level that's not allowing your body to remodel those bones correctly, it can lead to bony breakdown, which can make you more susceptible to getting a stress fracture.
The analogy we use with stress fractures, it's like bending a paper clip 1,000 times. As you bend it over and over, the paper clip, the stresses, the micro forces that over time kind of add up and eventually cause a fracture.
If you're having pain whenever you're walking around in the bone that's been affected with a stress fracture, we'll sometimes use crutches or a boot, or maybe even a cast. But really rest is the cornerstone of the treatment. There are two different types of stress fractures though. There are low-risk stress fractures and high-risk stress fractures. So low-risk stress fractures occur in bones that are very likely to heal with just rest. High-risk stress fractures occur in very tense parts of the bones that may not have the best blood supply. And so those particular types of stress fractures sometimes require surgery by someone like Dr. Lynch.
For acute fractures, it's going to depend on the extent of the fracture, how much displacement there is in the two ends of the bones that are fractured. If that's minimally displaced or not displaced at all and it's still lined up correctly, most of the time you're going to be able to treat those types of fractures without surgery. When the ends of the bones get more displaced or the alignment of the bones is angled pretty significantly, those tend to be more operative cases, depending on where the fracture is, depending on how you kind of attack that surgically.